All right, guys, welcome to another episode of HealthSpan Academy. We're super excited to have our guest here. This is Dr. Monique Mueller, who's got a very interesting, diverse background. And I've had the pleasure of meeting her back in 2015, and she's kind of been a go-to for me in helping solve a lot of my issues and some of my clients. So back in 2003, she graduated with a bachelor's in the University of Guelph, went on to complete a master's in physical therapy and Epping Master, and then went on to complete her PhD with a focus on osteoporosis, and then later completed a clinical master's in advanced manual therapy from Western. So that was her kind of experience academically. Since 2003, she's worked clinically as a physical therapist and has a lot of different unique designations, and she's done manual therapy, she's done acupuncture, she's done a lot of different stuff, and that's really helped her with her sort of diverse set of helping people resolve pain and prehab issues. And she also worked for a few years as an assistant professor at McMaster, teaching in the area of physical therapy. So, Monique, I want to welcome you here. First of all, thanks for joining us.
Thanks very much for having me.
Awesome. I want to start with sort of what's probably the topic most near and dear to people, which is the pandemic, and it's obviously impacted everybody. I think sometimes people just kind of go to a clinic and they're sort of through a lens of getting things solved. And they don't always see the world through the eyes of a clinician or a therapist. So I want to talk a little bit how it's impacted you as a professional, your mindset going into things, and also what you've seen clinically. Can you walk us through that a little bit?
Yeah, sure. The pandemic's been a huge change for everyone, and it's really affected people in lots of different ways. Myself personally, I didn't go back to an online format. There were several physios in my clinic that did do the online format. I'm primarily a manual therapist. I like to do a lot of hands-on treatment, and that wasn't ideal for me. So I waited until I was able to come back and do that one-on-one. That's sort of where I feel like I can have the best impact. As far as what I've been seeing with people is I'm seeing a bit more stress overall, right? People are walking through life now with all different stressors, some of them based on fear of getting sick, fear of losing your job, income, financial issues, uncertainty, a lot of uncertainty, and that all can definitely affect your body. And so I'm seeing that a lot more in the clinic these days.
Fair enough. Yeah. Awesome. I want to talk a little bit about your time when you worked in academia and teaching, because I find as a client of yours or a patient of yours, that's what I get most out of it, is that you're a fantastic teacher and you kind of walk people through the process. So was there a synergistic effect between when you were teaching and when you were working in clinical practice, or how did that work out?
Yeah, absolutely. It was actually a really good benefit to me because I did a lot of teaching of anatomy. So I really had to brush up on my anatomy when I was teaching it. That was helpful. And when I was teaching in the university, I learned lots of different ways to connect with people and how to explain different issues. And that helped me with my patients a lot. And I would say education is the number one thing that I do with everyone. I think it's really important for people to understand what's going on in their bodies and how they can fix it. And education's key. Yeah.
Yeah, I completely agree. I think my mindset around therapy has changed a little bit. I think when you're first started, you just think it's like this person that's going to solve all your problems and just kind of throw the solution at you. But it's really about working with that person and help them understand what the root issues are.
Yeah, 100%. And it's teamwork, right? The way I do therapy is really teamwork. It has to be a connection, a partnership between me and the patient. And if they're not on board, there's only so much I can do, right? I'm just really facilitating the healthcare for them. Yeah. They're the ones that do, all the work in their body. Yeah.
Absolutely. And to that end, I want to segue a little bit into how you approach a patient or client the first time, because you've got such a diverse set of tools to work with and such a diverse things that you're seeing clinically. What is your mindset when you approach somebody in terms of what you're looking for, just a generalized kind of template of how you approach someone's issue and start to find a solution for them?
Yeah, that's a great question. I would say first and foremost, I have a really systematic whole person approach. I don't look at just the body. At McMaster, we call it the biopsychosocial approach to healthcare. which a lot of medicine is going towards, luckily. That means we're including things like their home life, lifestyle factors, and other stressors, and not just the body itself. We look at ergonomics, we look at the whole gamut. But I say the number one thing I have to do is listen. That's the first thing I have to do, is I have to listen to the patient. I like to get to know them. I want to form a therapeutic alliance with them. I want them to be able to trust me and know that I'm here for them. But yeah, you're right. I do happen to have quite a few tools in the toolbox, so to speak. And so that's the fun part. That's the art instead of the science of physiotherapy and treatment, is really figuring out what you feel is going to be, the most important. So one client I might do dry needling with, another client I might do visceral manipulation approach, another client I might be working on stress reduction, so talking about breath and relaxation and mindfulness. Another client I might do soft tissue techniques on. Another client I might be primarily exercise. So I really have to get a sense of where the patient is and what their goals are.
For sure. Yeah, that's I think that's something I would say you've mastered. I think it's I can't even imagine trying to manage all those different systems, all the different tools, and then coming back to something central to focus on for them that day. And that's what I've always appreciated. I know we've mentioned like that mentality and the stress, and a lot of this is kind of comes down to the energy piece. And I know that Kyle and I both have a bit of an interest in that. So talk a little bit about how that factors in to you working with people, and what would make you focus in on someone's on that piece for a particular client.
Yeah. So I don't know if you've ever had this experience where you sort of walk into a room and you can feel the tension. It's like I could cut it with a knife, some people say. Sometimes I walk into the treatment room and that's what I feel. I walk in and I think, this person is struggling. Their whole system is just wound up. And anything I try to do with them, their system's not going to be receptive. They're in more of a stress state, more of a sympathetic state. So what I would do is I would walk them through, I would educate them and walk them through what the autonomic nervous system does and talk to them about stress. So I would tell them, you have an autonomic nervous system, which is kind of like your automatic system. It takes care of things like breathing, heart rate, blood pressure, sweating, digestion. And there's two sections to that autonomic nervous system. There's your sympathetic system, which we all know, fight, flight, freeze. And then there's the lesser well-known parasympathetic system, which is where you have rest, digest, and heal. And so if they're sort of hijacked and they're in this sympathetic state, anything I do is not going to really have the effects we want. So the first thing I have to do is educate them around that, and then describe to them how they can help themselves go from a sympathetic state to a parasympathetic state. And that's usually through breath work, because breath is the window in, because we can actually control our breathing. And when we change the way we breathe, we actually change our nervous system state, and we get ourselves from the sympathetic system into the parasympathetic system. And that can change all the hormones that are running around in your body, and that can set you up to digest and get the nutrients you need and heal yourself properly. So I might spend half the time just getting them into a state that I can help them when I work on them manually, and B, giving them something that is very functional for them to take home that they can use at any time, because they always have their body with them. So they can always be doing that type of breathing and relaxation technique. So it's very important. Yeah.
That's awesome. Just to sort of comment on that, I'm going to pass you over to Kyle for a few questions, but I completely agree. And it's amazing. Like, you just think it's breathing. It's something we're doing all the time, but it's unbelievable the amount of power that it has in shifting your physiology. And,
absolutely. And if I can get the patient to experience that at the time, if I can lie them down and say, okay, get into your body, feel what you feel, notice where you're at, notice how you're breathing. Do you feel tension anywhere? What's your pain state at? And then we go through this just even literally for a few minutes.
Yeah.
And they'll find that there's a huge shift, and it's so powerful. It's something you have with you all the time. So I really like to give people things that they can do themselves. Like, eventually the idea is for people to have more and more tools to manage their own well-being.
Yeah. That's awesome. And I think like that's something I struggle with for so long, because as a biomechanist, I see things as
Yeah.
mechanical. But if you're just like pushing against a wall, if you're in that sympathetic state constantly, you just can't break through. So
Yeah.
I think that's
Yeah.
one of the things that I've found really valuable in seeing over the years.
Yeah.
Yeah. So that's awesome. I'll pass it over to Cal for a couple questions for you now.
Yeah, no worries. Hey, Monique, I wanted to, I could probably keep going on the breathwork subject as well. Just one thing I wanted to note was, for my own personal experience, was it's not just a mental issue as well. Like, a lot of people think stress and that's what's causing you to stay in that fight or flight. But for me, it was physical, just over exercising and just not sleeping enough and just under recovered. And then I went down a path of measuring my heart rate variability on a daily basis, and it brought some awareness and into my life, and started working out kind of more efficiently as opposed to hard, like 3 hours a day, and I started working out half hour every 2 days, but more efficiently, and really brought myself back to a good spot where I was sleeping much better, and there's so much power in it. So I appreciate you talking about it, and I really wanted to kind of switch gears into the proactive side of things. I know that once you have the symptom, it's it's not that it's easier to figure out who you need to go see, but at least you once you have the symptom, it's kind of already, something's already had happened, right? So what sort of advice, information, or things that you could offer to our listeners to kind of watch out for, and maybe if they notice them a little bit sooner, they can seek the help a little bit sooner before they actually get the full-blown symptoms, or just things to be mindful of?
So two words that you've used there, I would say, are really the pivotal piece in this, and it's being mindful and being aware, right? Which cross over. And you were talking about the awareness that you were starting to build around yourself. And I think a lot of times we get lost in, and we think exercising over and over and over again is okay, but it's another sort of distraction and coping mechanism we have for stress, which may or may not be helpful. The right amount, like you're doing now, you're recognizing is so much more healthy for you, right? For your overall well-being. So being aware, really checking in with yourself. When you're going to do a certain movement, are you starting to compensate? Are there things you can't do that you used to be able to do? Instead of bending down and squatting to get something, maybe you're starting to bend over at the waist because your knees are sore, or your hips are sore, or something like that. Maybe you change how you're sitting because you can't sit the way you used to sit. Maybe you aren't doing the same activities because something's bothering you. So those are all little pieces of information, little hints that things are starting to change, and maybe your strength or your mobility or some of your proprioception and your motor programming, so things are starting to change. And so that's a good indicator that, maybe I need to look at this in a little bit more detail.
Right. And then, that leads me into asking about some of the more common mobility issues that you do see patients that come in. Could you talk about kind of more of the, if I had to stab a guess at it, or take a guess at it, I would think that sitting is a big one, and then stress, like you alluded to before. Kind of what are the most common things that you find people come to see you for?
Yeah, I would say there's a huge variety for sure for me. I literally treat head to toe, but common patterns that we're seeing, especially I would say in the last year with the pandemic and sort of that undercurrent of increased stress, would be low back pain would be some of it. So, we could look at it through a lens of mobility and saying people are sitting more, but you could look at it through another lens and say that your adrenal glands are sitting right there in your back. And with increased stress, there's going to be more firing of your adrenal glands, and that's going to change how your back's moving. Tension in the shoulders, again, through being on Zoom all day long for people. But people also kind of hold their stress there sometimes, right? Different people hold it in different places. So it's hard to give an answer of, this is the one thing we see, because everyone's so different.
Right.
But we do see themes like you're alluding to. And so I would say shoulder, neck, and then low back would be some of the common ones over the past year that seem to be creeping up in prevalence.
Right. That takes me back to, I started meditation probably maybe 2 years ago now. And, I went kind of the longest time without really understanding what I was trying to accomplish. Not that there's anything to accomplish in meditation. It's about not accomplishing anything. But just like true, true awareness and just being present and clearing the mind. And then I eventually learned that, when you're doing that full body scan through meditation and you're looking for those tight spots, like a lot of us just aren't aware that we are retaining so much tension in these areas of our body. And then, like you talked about, it specifically means something. Typically you're holding on to, the stress of, whatever it may be. But I really admire that approach, the biopsycho approach that you were talking about. So, what's kind of the next? So you kind of talk about common mobility issues or just kind of patterns that you see. I also kind of wanted to talk about like exercises that you typically give, but and I know you kind of talk and say that you give. You could have the same patient with the same, or two different patients with the same issue, but you could give two different recommendations. What could you tell our listeners about kind of being able to take a proactive approach without even before kind of issues creep up, like if they're sitting all the time, or if they're caught, if they're noticing that stress in their neck, what can they kind of do?
Yeah. So we know that, there's been a lot of talk about sitting being the new smoking and that sort of thing, right? So we know that being stationary is not super helpful for our body. The body's meant to move. We really need to get our joints and even our nervous system, we need to get it moving so that the fluids can help it be more dynamic. So getting up, moving around, super important. I know people have wearables now with their watches that are telling them to get up every, half hour, that kind of thing. That certainly helps people start moving. I think one thing that I really love is doing something that that brings you joy, right? So one thing I did recently was I tried this online dance class from a guy in Israel. I think he's on, there's a Netflix series called Move, and I think he's the second episode. Ohan Naharan, I think is his name. And he's developed this new dance technique called the Gaga technique. It's been around for quite a while. It's not related to Lady Gaga in any way, but he's described moving in a way that I've never conceptualized before. And it was fascinating to me, and it was so fun and so freeing. And I think it's just really important to allow ourselves to try new things and to enjoy what we're doing. So it was just so fun to let go and move in a completely different way. So, sometimes I'm doing, some kind of just dance with my daughter, having some dance competition. That's fun, getting up and moving, but going for walks, getting into positions that you don't normally get into, trying some yoga. If you haven't done yoga before, you don't have to be good at any of it. You just have to really enjoy exploring how your body can move. And sometimes you learn how it has trouble moving. And then that can be an indicator that, hey, maybe I need to work on this area.
Yeah, absolutely. I think people underestimate the power of getting outside and going for a walk and how much that can accomplish. And then I know you were talking about the dance classes. I recently heard of acro yoga. I had never really heard about it, but I haven't looked into it yet, but it definitely sounds like, especially with a partner, it sounds like something that would be, I don't know, interesting and fun, and probably put me outside of my comfort zone. But I kind of enjoy doing that. So I just wanted to talk a little bit more about, the other options or the other therapy devices that you do have in your toolbox. I know you do manipulation therapy. If you could kind of explain what that entails, and then I was going to ask a question kind of about misconceptions or things that people typically misunderstand about kind of the type of practices that you use.
So manipulation therapy, there's lots of different ways to do manipulation. And so sort of the traditional type would be more of what chiropractors do when they quote unquote crack your joints. But that's not really the style. I do that type of manipulation. I'm doing that less and less. The type of courses I've been taking in the last decade or so have been more around connecting with fascial tensions and unwinding that. So I've been doing visceral manipulation, neural manipulation. So what I do is I feel for tugs or tight areas in the fascia. And these tight areas in the fascia, it's kind of like they've been locked down, right? So they're not really moving. And so all the receptors in that fascia haven't been stimulated because they're basically on lockdown, kind of like we have been through COVID. We're not going anywhere, right? We're not moving.
Is the fascia just like just under the skin, between the skin and the muscle, or where's the fascia?
So the fascia runs everywhere. It's long sheets of connective tissue. Again, literally go head to toe, wrap around muscles, wrap around bones, wrap around vessels, vasculature, nerves. It connects your organs. Like it turns into ligaments, basically wraps around your lungs. It covers and wraps around everything. It's connective tissue throughout your body. And when I feel that there's a tight area that's restricting movement, then what I do is I basically connect in with that area very gently. There should be no pain with it. It's a very subtle and gentle technique. And I basically reconnect it with your nervous system by stimulating the proprioceptors that are in that tissue. And then the nervous system sort of goes back online with that tissue, reconnects, and I help support that tissue as it unwinds and lets go a little bit. And so there's not as much restriction at the end of treatment. So that's the type of manipulation that I do now. It's more of sort of I guess you could say it's more of what some osteopaths do. The fascial work would be a fascial unwinding would be an osteopathic style of technique, but there's other ways you can work with fascia as well. There's obviously the stretching that we do. Stretching of muscles will also put input into the fascia. There's some soft tissue techniques that we use. Any massage therapist will tell you that they're not just working with muscles, they're also working with the connective tissue and the fascia. So that's the type of manipulation that I do now more so.
And then some of the other tools you use, do you, I'm trying to think, you had a pretty long list.
I do a lot of dry needling.
Right.
I do quite a bit of dry needling. Yeah, not acupuncture specifically. I haven't been trained in that, but I do dry needling, which is using acupuncture needles, but instead of putting them in along the lines, the chi lines of energy, I end up putting the needles into a tight muscle band and stimulating that muscle to contract. And that helps the muscle to relax. It sends a loop back, a feedback loop to the spinal cord, and it resets the muscle length to be at a slightly less tense or a longer resting length. And so that can help reduce compression across joints and muscle tone. That works really, really well on more persistent pain patients. There are issues that have been around for a long time because we're kind of retraining the nervous system. And I think actually any technique that I use, from exercise to dry needling to I do dermal neuromodulation, which is another fun technique. That's all working through the nervous system, right? So we're just working through the nervous system. We're either trying to modulate it in some way, either up or down, to make the patient move better and make their restrictions relax a little bit more, make their motor patterns work a little bit more effectively. Yeah.
Awesome. I really appreciate you spreading some light on that. I assume you work a lot hand in hand with your patients, like to kind of guide them, like pre and post kind of sessions with you. Is there a lot of exercises, or a lot of any specific thing that typically that you recommend your patients before they come see you or after they see you? Like I'm sure you just kind of work with what issue they're having, but
Yeah, it's very individual for sure. If I find I'm giving them a lot of exercises, then I'll usually we have a program where we can email people the specific exercises, and it has video explanation as well as written explanation and pictures. So I think a lot of people find that pretty helpful, and I like people to have that reminder because sometimes it's a lot of information to get in one session. Yeah.
Yeah, give them the toolbox, but ultimately they're the driver in the driver's seat, and it's up to us individually to take action if we want to be proactive and change our outcome ultimately over the long run. So awesome. Well, I really appreciate that. Over to you, Craig.
Yeah. So I just kind of rolling on the proactive approach. I want to talk about your personal habits. You've been very active, and you've had a little bit of physical limitations over the years. You tested out the gym for a bit and had some personal reasons that the format didn't quite work with your body. Talk about how your habits have kind of shifted. I know there's a lot of different directions we can go when we come to health, right? We could think mental health, we could think, conditioning, we could think functional strength, we could think nutrition and body composition, and the list goes on and on, especially because so many systems. I want to know where your focus is at these days. What is your main priority with your own personal health and fitness, and what do your habits look like around that?
So, I would say the number one thing for me, because I feel it really is the base of everything, is my mindfulness work and my meditation work. Because when I'm connected to myself, I'm aware of whatever physical issues, whatever mental issues, emotional issues are going on, and that's going to allow me to make some changes to that and improve my well-being. So that's probably the foundation. And then from there, moving. I love to move. And personally for me, I've started biking a bit more because I'm doing the Tour de Guelph. Thank you for sponsoring me, Craig.
Yeah. No
so
worries.
We're raising money, right, for the hospital here in Guelph. So biking a bit more. I find strength really important personally. Strength really helps with my function and some mobility work. And, my mobility work is pretty specific based on what's going on right now. I'm working on my left hip, right? But there are general mobility things I do. I like to get some yoga in regularly, but strength work and biking and going out for walks with friends. So what I would say is that going for a walk with a friend is a triple bonus because you're moving, you're out in nature, and you've got authentic connection, right? So all of those three are super important to me. I have gardens. I do also, that's a big part of getting, feeling healthy is gardening and getting literally hands in the soil, bare feet on the ground.
Yeah.
And authentic connection, having that support network, super important for being healthy. And then my diet would be, it's mostly plant-based, mostly whole foods. And I feel better when I eat less carbs for sure, but that's not to say I don't enjoy a good brie on the barbecue with half a baguette, right? So I don't deprive myself. And then other things that I think about for my overall well-being is I try to reduce EMF, so radiation. I'm sure Kyle knows a lot about that with his flying. So like right now I'm hardwired in for this Zoom call, right? So reduce Wi-Fi, turn it off at night when I'm sleeping, because that's really when we get to do a lot of our healing. So put my phone in airplane mode when it's on my body, little things like that to try and reduce that. Those are I'd say are the main things I do for my own well-being.
Awesome.
Yeah, the EMF I think that's going to be something that we just learn more and more about. Like it wasn't around, and then it kind of became something through Wi-Fi and through 4 and 5G. And the problem is that we don't know the effects until it's too late, right? So it's something else, and I know there's studies on it already, and trying to limit that is, like you said, there's something to it, and I've noticed it myself in my daily routine. So
I think it's going to be super important. And I believe it's a little bit like smoking and big tobacco. I think the cell phone companies, they have a lot of money and they have a lot invested in this, and they're really trying to hide the detrimental effects. There's a really great TED talk on it. Is it Johnson. I can get that information if you want to put it in the podcast.
Yeah, absolutely.
Information later, but it's really important. I think more important than we recognize right now. It's just way too convenient for us to have our phones with us all the time and have Wi-Fi everywhere. But
yeah,
I think it's Belgium that's now taken out all their Wi-Fi and hardwired their schools because they're recognizing that, especially for growing brains, it's not good, all that radiation.
Yeah, fair enough. I want to segue into a reference, and it might be related to EMF. You actually recommended a really good read for me, The Biology of Belief, which I loved, because that was like, for me, it was kind of, the first half was like a review of my undergrad stuff I hadn't heard in almost 20 years. And the rest was like stuff that's been more familiar to me, but it's less understood. So I love that read. Has there been a reference for you in the pandemic that stood out that you can maybe recommend to some people listening?
Yeah, I really, really like The Biology of Belief, because it helps us understand a little bit more about how quantum physics and energy is really affecting us, right? I think what we're going to learn as we continue with all the science that's coming out is that Newtonian physics really doesn't explain everything as well as we had hoped it would. And that quantum physics is really going to be explaining things more. And it's actually amazing, because it gives us this power, this control over our destiny, over what our bodies are going to be doing. We are not, like we used to think, just at the mercy of our genes. We really aren't. We can help control how those genes are going to express themselves. And that's a whole field called epigenetics. Mm-hmm. And so what we're learning now is that with quantum physics, everything's energy. We know this. And that energy affects how our genes express themselves, and everything's energy. So things like emotions, limiting beliefs, thought patterns, all these things can affect how our genes are going to be expressing themselves and how healthy we're going to be in the future. So we have a lot of power over that. And I think that's really exciting.
Yeah, I agree. It's like, you kind of think of emotions as something specific, that's like something kind of mystical, but they are physical, and they're just hormones. Like it's really interesting. And so that's what really stood out with me with the book. So thanks for that recommendation.
Yeah. I think one of the best ways to get people to connect with that is to tell them, like, you have to go do a speech in front of 1,000 people, and people say, oh, I got butterflies in my stomach, right? So immediately a thought and an emotion is transferred into a physical sensation. 100%. So we know it affects our body. We know that. Yeah.
That's awesome. That's a really good analogy. Awesome. Well, thanks so much for joining us today, Monique. I really appreciate your time.
And, thank you very much. This
absolutely.
is great.
We'll have to have you on again for part 2 later on, hopefully when we're out of this crazy pandemic world we're living in right now. Awesome. Well, thanks for tuning in to this episode today, guys, and we'll see you next time on Health Span Academy.